Hello everybody, this is Dr. Omid, and in this video I'm going to talk about the male genital organ. I hope you like this video. Thank you for your attention. Regarding the male genital organ, the male genital organ is divided to the two main parts. Internal male genital organ and external male genital organs. Regarding the internal male genital organ is starting as a testicle or testis, which is the main glands for the internal male genital organ, and is producing the sperm. Then is epididymis, which is the function is the storage of the sperm. Then it's continue as a deferent duct or ductus deferens. Then is seminal vesicle, is the gland, is another gland that is producing approximately 60% of the ejaculatory fluid. Then is prostate, which is another gland that is producing the 30% or the rest of the ejaculatory fluid. And then is penis, that inside the penis is passing inside the spongy part of the penis, it passes the urethra, which is the same pathway for the urine and the same pathway for the sperm. So regarding the external genital organ, it's what is outside from its name. It means it's penis and the scrotum, which it contains the testis and epididymis. Regarding the internal genital organ, testis, epididymis, ductus deferens, seminal glands or vesicula seminalis, prostate, and also there is another gland which is lubricating the wall of the urethra, is bulbourethral gland or Cowper's gland. So those are the internal. So once more, external is penis and scrotum, and internal is the rest of the structure that I mentioned. So now we are going to discuss the details of each structure. So regarding the first part, which is testicle or testis, is the main organ or internal genital male genital organ. It's paired and is located inside the scrotum. The scrotum, as we mentioned, it belongs to the external genital organ. So testis inside the scrotum is the position is vertically is located. It's ellipsoid shape, and it's very sensitive organ to pressure and trauma. So it's on the surface of the testis. It's very smooth. It's covered by the layer that is called tunica albuginea that we are going to discuss. And over the tunica albuginea, it's covered by the peritoneum, which has the two layer, the visceral layer, which is called the visceral layer of the tunica vaginalis or vaginalis, which is called epiorchium, and the parietal layer, which is the parietal layer of the tunica vaginalis of the testis, which is called periorchium. So regarding the macroscopic anatomy of the testis, we have, as we said, is ellipsoid. The supero-inferior nebocraniocaudal dimension is approximately 4 till 5 centimeter. Antero-posterior dimension is approximately 3 till 3.5 centimeter, and the thickness or the lateromedial dimension is approximately 2.5 centimeter. The weight of the testis is approximately 18 till 25 gram, and as you know, the left testis is heavier than the right testis, and that's why usually the left testis is located approximately 1 centimeter in the lower position than the right side. We have extremitas superior or superior extremity or superior pole of the testis. We have the extremitas inferior or the inferior pole of the testis. It has two margin, the anterior margin, which is the free margin, and it's convex anteriorly, and then it's the posterior margin, which is the margin that it's attached to the reflected serous fold, and in this posteromedial direction, or the posterior margin, it's the place that the epididymis is attaching to the testis, respectively, in the posteromedial part of the testis. Testis has two surfaces: the lateral surface that is convex, and the medial surface, the other side, which is flat. So those are the macroscopic structure that you can see in the testis. So two extremitas, superior and inferior, two margin, anterior and posterior. The anterior one is free, posterior one is attached to the epididymis, and two surfaces, lateral and medial, which the lateral is convex and medial is flat. Testis is also, as you see, it's connected to the scrotum in the lower pole of the testis via this ligament, which is called scrotal ligament or gubernaculum testis, which is fixing the lower pole of the testis to the wall of to the internal wall of the scrotum. So here you have the sagittal cross section through the testis. Inside the testis, in the sagittal cross section, on the surface, you can see this whitish structure, which is called tunica albuginea. The tunica albuginea, as we said, it's the dense connective tissue that is covering the testis, and it's white. That's why it's called tunica albuginea. And wherever we are going toward the inside of the testis from the surface, so then we are reaching to the more reddish structure, which is highly vascularized, and that's why they call it tunica erythroida, and it's very firm, and you cannot separate it. The tunica albuginea, it can be easily separated from the surface of the testis, but the tunica erythroida, because it's highly vascularized, so the color is red. That's why they call it tunica erythroida, and it's not you are not able to separate it from. As we mentioned it also, and we are again repeating, on the surface of the tunica albuginea we have the remnant of the peritoneum, which is covering the testis, and it has two layers. This peritoneum is called tunica vaginalis, and it has two layers. One is on the surface of the testis, which is called visceral layer of the tunica vaginalis, and it's called epiorchium, and the other is the parietal layer of the tunica vaginalis, which is called periorchium. And then if you are going inside the testis, you see that you have the structure that they are called lobules of the testicles or testis. There are the lobules of the testis, and the lobules, they are separated by these structures that they are called septulum or septuli of the testis, that separating each lobules of the testis. So there are approximately 200 to 300 lobules that the base of these lobules, they are toward the surface, and whenever they are going to the posterior margin of the testis toward the hilum or hilus, which is the place in the posterior margin of the testis, and it's the place of the entrance and exit of the vessels and ducts that I'm going to discuss. So the apex, it goes toward the posterior side. So inside the lobules of the testis or testicle, as you see here, it's the more details. You can see some ducts that they are called seminiferous tubules or seminiferous ducts. These seminiferous tubules, in the beginning from the base, it's the convoluted part, so they are turning around each other, so they call it the convoluted part. And whenever we are reaching toward the apex of these lobules and we are going towards the hilus, so then it becomes straight, which is called the straight part, or the tubuli seminiferous recti or rectus. And here the beginning is the convoluted part, they call it tubuli seminiferi contorti. So this convoluted part and the recta, inside these tubules, the seminiferous tubules, this the process or the procedure that is called spermiogenesis, it's happening. And this whole procedure of the spermiogenesis, that it's production of the sperm, and the maturation of the sperm also, it happening. It's called, it takes approximately 74 to 76 days, and it has the two phases of this process. One phase is the production of the sperm by the mitotic division and mitotic activity, which is called spermiocytogenesis. It means that it is originated as a mitotic activity of the it's changing to the spermiocyte type 1 and then a spermiocyte type 2, and then it's matured or is becoming another division which is called a spermatid. This spermatid is not ready for the fertilization of the ovum, and in this case it needs the maturation of the spermatid to the mature sperm, and the maturation and the process of the maturation of the sperm is called spermiohistogenesis. And this spermiohistogenesis, this process, it's the cell that is very important. It has a very important role for this procedure. It's called Sertoli cells, that it's very important for maturation and maturation of the sperm. So it means that it's the function is phagocytosis, the function is the supporting of the sperm, secretion of the secretion for the nourishment and nutrition of the sperm, and also it's playing role like a barrier. So whole this production of the sperm and maturation, which is called a spermiogenesis, which is divided to the spermiocytogenesis, which is the mitotic activity it happening, and the spermiohistogenesis, which is the maturation of the sperm, it's happening. It's continue and it happening inside these seminiferous tubules. These seminiferous tubules at the apex of each lobules here, they are directed toward the ducts that they are called, the group of the or network of the ducts that they are called rete testis. Rete testis, they are the network of the ducts that they are connecting the straight or rectal or rectus part of the seminiferous tubules toward the ducts that they are leading to the head of the epididymis, that in a while I'm going to discuss. These ducts, they are called efferent ducts or efferent ductulis. So rete testis is connecting the straight seminiferous tubules toward the efferent ducts or ductules that they are carrying the sperm toward the head of the epididymis. And these rete testis, they are located in the area which is called mediastinum testis. This mediastinum testis is the connective tissue which is radiating from the posterior margin of the tunica albuginea into the interior of the testis. So this rete testis is located inside this area, which is called mediastinum testis. So in this case, so the sperm that is produced inside this seminiferous tubules directed from the pars contorta to the pars recta, and then through the rete testis it goes to the efferent ducts or ductules or efferent ductules. It's going to the head of the epididymis, and inside the epididymis the storage of the sperm is happening, and also the continuation of the maturation of the sperm also it's happening in this area. So this is important for about the sagittal cross section of the testis. So here in this picture you can see the transverse section through the scrotum that the testis, they are located, the right side and the left side, they are located inside the scrotum, and this is the view from above, and between these testes there are the septum, which is separating the left and right testicles or testis. Here you can see the cross section. Again, you can see the lobules of the testis, and between them there are this septulo or septuli of the testis or testicles. And in the posteromedial side you can see the epididymis. This is the cross section of the epididymis, and here there are the place of the ductus deferens that we are going to discuss. What I wanted to show you is that on the surface of the testis you can see that this whitish structure that you can see, it's the tunica albuginea, and on the surface of this whitish tunica albuginea, it's the visceral layer of the tunica vaginalis, or the epiorchium that is covering exactly on the surface of this tunica albuginea. This is number 2, and the other part, which is here, and it's number 1, it's mentioned here, is the lamina parietalis, or the parietal layer of the tunica vaginalis, which is called the periorchium. And between the tunica, the visceral layer and parietal layer, or the epiorchium and periorchium, there is this cavity which is called the serous cavity of the scrotum. The serous cavity of the scrotum, in the case that in some case the serous secretion will be accumulating in this cavity, the cavital place of the scrotum or serous cavity of the scrotum, it's making or forming the disease which is called hydrocele or hydrocele. It's the accumulation of the serous secretion in the cavity or the serous cavity of the scrotum. So this is the regarding the surface of the testis. And now I'm going to tell you about the details, what will happen inside these lobules of the testis, that it's located, the seminiferous tubules that I already mentioned, and the spermiogenesis is happening. So here is the transverse or horizontal cross-section through the seminiferous tubules of the lobules of the testis, inside the testis. We said that here, for example, if we consider here is part of the lobules, and here they are the inside the seminiferous tubules. In the beginning, we have the cell which is called spermiogonia. Spermiogonia is the first cells that it's going under the mitotic activity and our mitotic division. And it's becoming mature, and then it's making the another cell which is called spermiocyte type 1, and then the spermiocyte type 1 also it's going to change and undergoes the division to the spermiocyte type 2, and the spermiocyte type 2, then it's furthermore it's converted to the and divided to the another cells here that they are called spermatids. And spermatids, they are unmatured sperms that whenever they are going toward far from the convoluted toward the rectus or the straight part of the seminiferous tubules, they are becoming mature, and finally here they are the mature sperm or a spermatozoid. It's happening here or is produced here thanks to this bluish color cells that they are called Sertoli cells, that we said that it has a supporting cells and for the nourishment and secretion and the supporting and phagocytosis and the barrier for the sperm. And finally the mature sperm is producing here, and it's going here toward the retetestis, and through the retetestis is going through the ductuli efferentes or efferent ducts toward the head of the epididymis. So this process, that it's the division process of this spermiogonia, spermiocyte type 1, spermiocyte type 2, spermatids, and then the maturation and the sperm. It's called spermiocytogenesis, and the process of the maturation of the sperm is called spermiohistogenesis, which is the Sertoli cells is responsible for this maturation. Another cell also is located inside the testis, and there are these cells, and they are very important cells that they are called interstitial Leydig cells. Interstitial Leydig cells, here is the cross-section of the capillary with the red blood cell inside, and here the interstitial Leydig cells that they are responsible for the production of the male hormone, which is called testosterone. So Sertoli cells for the supporting and the secretion of the electrolyte, the protein, steroid, the ions, for the maturation of the testis, for the sperm, and the secretion to the fluid, and the secretion for the helping to move the sperm toward the head of the epididymis. And another cell is the Leydig or Leydig interstitial cells is responsible for the production of the testosterone hormone. Okay, next part after the testis is epididymis. Epididymis is the part of the internal male genital organ which lies posteromedially on testicle and serves as a storage organ for sperm. As we mentioned, from the tubules, from the seminiferous tubules and retetestis toward the head of the epididymis, it's passing the efferent ductulus or efferent ducts, and carrying the sperm toward the head of the epididymis, and it's continue downward that I'm going to explain. First, the main part of the epididymis. The main part of the epididymis, first the most superior part and the widest part of the epididymis is called head or caput, and this is the part of the epididymis that is composed of these efferent ductules. Then it's becoming a little bit narrow, and here is called corpus or body of the epididymis, which is the middle portion of the epididymis and is composed of the coil duct of the epididymis. And then finally the most narrowest part of the epididymis, which is called tail or cauda of the epididymis, and it's composed of the coil duct of the epididymis as well, and then it continue posteriorly and superiorly as a ductus deferens that we are going to discuss. The epididymis also, like testicles and testis, it's covered by the serous membrane, which is called tunica vaginalis or vaginalis, and it means that it's covered by the peritoneum, and this peritoneal fold that it's making a recess between the wall of the epididymis and the lateral surface of the testis. This is called the sinus of epididymis. Sinus of epididymis is a recess, is a peritoneal recess of the tunica vaginalis between the body of the epididymis and the lateral surface of the testis, and this sinus of the epididymis superiorly and inferiorly is fixed with the connective tissue to the testis via two main ligaments. One is the superior ligament of the epididymis, and the other is the inferior ligament of the epididymis. To show the fiber of the connective tissue which is connecting the epididymis to the testicles. And as we mentioned it before, it's another ligament which is connecting the testicles toward the lower pole of the testicles toward the interior wall of the scrotum, so to the lower part of the scrotum. So this is all about the fixation and the part of the epididymis, and I'm going to discuss about the details of the inner structure. So regarding the epididymis, as we mentioned it, we have it's located in the posterior medial surface of the testis, and toward the head of the epididymis it's going the efferent ductules, and from the efferent ductules that they are going toward the head of the epididymis, continuing 8 till 12 canals that they are making the lobes of the lobules of the epididymis, and from these canals they are toward the body and tail. We have only one canal which is called the epididymic duct or duct of the epididymis, which is from the body is going caudally and toward the tail of the epididymis, and it continues as a ductus deferens. So this is all the passage of the sperm from the seminiferous tubules toward the retitostis, toward the efferent ductules, toward the head of the epididymis, and continue to the lobules of the epididymis, and then it continue as a one duct of the epididymis from the body to the tail, and then continue as a ductus deferens. Of course, if you are looking at the epididymis and testis, you can find some rudimentary structures and the remnant of the embryonic structure, which are the rudimentary, and it's, for example, the appendix testis. This is located at the superior part of the superior pole of the testis. The other is the appendix epididymis. So this is located at the head of the epididymis, and also we can find the aberrantous ducts or aberrant ducts, that they are superior and inferior aberrant ducts, and also you can find the paradidymis or paradidymis, which is in the cranial part of the head of the epididymis, and those are all the rudimentary structure of the developmental structure of the testis and epididymis. So here we have the testicle. Testis or testicle, as we mentioned it, the superior and inferior dimension or crânio-caudal length is approximately 4 till 5 centimeter. The antero-posterior dimension is approximately 3 till 3.5 centimeter, and the mediolateral dimension or thickness is approximately 2.5 centimeter. It has the macroscopical view. The testis has superior pole or superior extremities and inferior pole or inferior extremities. It has free anterior margin, which is free, and posterior margin, which is in the posteromedial side. It's the position that lies the epididymis. Here is the flat surface of the medial surface, and the other side, it's the other surface is a little bit convex, which is in the lateral surface. So as I mentioned it, the testis is on the surface is covered by this layer, which is called tunica albuginea. As you see, is whitish, and it's removed from the surface of the testis. And if I open the testis here, then you can see it's under the tunica albuginea. It's followed by the tunica erythroida, which are composed here. They are composed of the lobules of the testicle, which is separated by the septulum or the septuli, and inside these lobules they are passing the seminiferous tubules, the conturta and recta. In the dorsal part, here it's the place that it's the mediastinum testis, that it's contained of the rete testis, is the collection of the ducts that they are connecting the seminiferous tubules to the efferent ductules that they are going inside the head of the epididymis. So here is another testis that you can see here. Again, you can see the superior, inferior extremity, anterior margin, posterior margin, medial, and the lateral surface. And here you can see the tunica albuginea. Then it reached to the tunica erythroida. So here there are the lobules of the testis inside, and we already mentioned that those area is inside. There are the seminiferous tubules that with the eye is not macroscopically seen here. So here in this region, the place of the entrance and exit of the vessels, here there are testicular vein and testicular arteries that are going to the hilus, and hilus is located in the dorsal part. And again, here in the dorsomedially, it's located the epididymis, that it composed of three main parts: the head, which is the widest part, then it becomes mid portion, which is called the body, and then finally the lower part, which is cauda or tail of the epididymis. This organ is for the storage of the sperm, and then it's followed by from the cauda, it's followed by this structure, which is called ductus deferens, that we already mentioned is approximately 50 to 60 or 40 to 60 centimeter length, and it has different part according to its pathway. So here you can see very nice the place that the fixation of the epididymis in superior part is the superior epididymic ligament, and in inferior is the inferior epididymic ligament. That is the place that the epididymic sinus is finishing. It's the reflected of the and recesses of the tunica vaginalis, which is covering the testis and epididymis. So here you can see very nice the surface of the testis, which is covered by the tunica albuginea here, and this tunica albuginea then is covered by the tunica vaginalis, which has the visceral layer, which is called epiorchium, and the parietal layer, which is called periorchium. And this processus and the tunica vaginalis, as you see, is covering also the epididymis. So epididymis also is covered by the peritoneum. And if I put it away a little bit, so you can see the beginning of the epididymis in this area, and those are the place of the structure inside the funiculus spermaticus, or a spermatic cord that we already mentioned the structure. So here is the similar preparation of the testis. So as you see, this is the covering the tunica vaginalis, the periorchium, epiorchium, and then after the removing, it's the tunica albuginea, which is smoothly and is whitish and is covering the testis. What I wanted to show you that this peritoneum, this the continuation of the peritoneum, it's reflected around the epididymis here. So and here it's the posteromedial surface of the testis, and here is the head of the epididymis that you can see, and here it's the superior epididymic ligament. And here between the lateral wall of the testis, or the lateral surface of the testis, and the body of the epididymis, this is the reflection and the recession of the tunica vaginalis here, which is called epididymis sinus. And here is the place that the efferent ductules, they are entering to the head of the epididymis, and head of the epididymis, as you see, epididymis is covered also by the peritoneum. If I remove it here, so it's continue the head, the widest part as a body, and the tail then it continue here to the as a ductus deferens. You can see here inside the funiculus spermaticus that it goes toward the inguinal canal. Before I continue with the next part, which is scrotum, and it's belong to the external male genital organ, I have to tell the important process that is called the sensus testium. Is the pathway of the testicle or testis from the abdominal cavity toward the scrotum. This is, as you know, the testis or testicle is located inside the abdominal cavity together with the epididymis, approximately at the level of L1, L2 inside the abdominal cavity, and is covered by the visceral peritoneum. And then around 28 weeks of the after the birth, so the inguinal canal, the testis is descending, and approximately in the 33 weeks, it's descending toward inside the scrotum. So approximately after the 33 weeks of after birth, so in 97% of the cases, the examination of the scrotum is very important in pediatric department to see if the sensus testium, or the descending of the testis from the abdominal cavity toward the scrotum, it happened or not. That is 97% it happened. So the passage of the descending of the testis toward the scrotum, it's according to the passage of the or the pathway of the testicular artery happening. So, and if there are any abnormality happening, which is called if it's the testis is trapped during this pathway, is called the retention of the testis. If it goes to the other place that is not normal, it's called ectopic place of the testis, or if the position of the testis it's vice versa. For example, the anterior superior pole, it goes like an inferior pole, or vice versa, or upside down. It's the atypical position of the testicle. Is called inversion of the testis. So this is important, that very important, that in the pediatric examination, so always you have to touch in the 33 weeks after birth, so the testis must be located inside the scrotum. So now it's regarding the scrotum. A scrotum, as I said, that is part of the external male genital organ. It's pear shape. It has a pear shape, and it's at the surface. It's covered by the skin. This skin is covered by the hair most of the time, and this skin is pigmented. Also, it's composed of a lot of sweat glands and sebaceous gland. Also, the scrotum left and right, it's dividing by the septum or scrotal septum, which is in the midline and sagittally. It's dividing the scrotal cavity to the two left and right for each testicle, left and right testicle. And the structure of the scrotum is important. First of all, the scrotum, why testis is outside of the body or outside of the abdominal cavity? Why the testis must goes to the scrotum? This is because that the temperature inside the scrotum is approximately 2 degrees of the Celsius, is lower than the temperature or the body temperature. And this is important for the process of the spermiogenesis. So this spermiogenesis in body temperature, it's not possible to be happen, and that's why it needs the lower temperature that it's inside the scrotum, and that's why the temperature is the 2 degrees of the Celsius lower than the body temperature, and in this case is allowing the process of the spermiogenesis inside the testis. This is the most important function. So it's the regulation of the temperature for the spermiogenesis. And the very, very important is the layer of the scrotum. So the layer of the scrotum, as you see it in this picture, it's as a matter of fact, is continuation of the layer of the anterior abdominal wall, that it continue down and is continue as a layer of the scrotum. So if you are going from the outside from superficial or outside of the anterior abdominal wall, the first layer that you can see in abdominal wall, it's the skin, and the synonym layer that you have it in the outside of the layer of the scrotum is also skin. So always be careful, the synonymous layer that you have it in the anterior abdominal wall, and the synonymous layer that you have it in the layer of the scrotum. So the first is skin, that is the synonymous in the layer of the scrotum is skin. It's together. As we mentioned, the skin is pigmented, it contains a lot of sweat glands, sebaceous gland, and it has some hairs most of the time on the skin of the scrotum. So, and the skin in the scrotum is very thin as well. So, in this case, then, the second layer, that from the abdominal wall, if we go, it's this layer. This layer is in the abdominal wall, is called Scarp's fascia. Scarp's fascia, it's the fascia which is under the skin is located, and it's the subcutaneous fascia, and it's continue toward the scrotum as this layer, the second layer, which is called tunica dartus. Tunica dartus is composed of the smooth muscle, which is called musculus dartus or dartus muscle, and it's the subcutaneous connective tissue musculus dartus that it has an important role for the regulation of the temperature of the scrotum that I'm going to discuss now. The third layer that you can see here, it's the superficial abdominal fascia. The superficial abdominal fascia, as you see, it's covering the most external muscle of the abdomen, which is called the obliquus externus abdominis muscle. And if I continue this layer toward the scrotum, I will reach to this layer in the scrotum, which is called external spermatic fascia. External spermatic fascia, it means that it's corresponding to the superficial abdominal fascia of the abdominal wall. Then the next layer that is covering the external oblique muscle. Then after this external obliquus externus abdominis muscle, we have two further muscle. One is the musculus obliquus internus abdominis, or internal oblique internal abdominal muscle, and the transversalis abdominis muscle. This internal, the obliquus internus abdominis and transversalis abdominis muscle together, these two muscles, it's continue inside the scrotum, and it has a layer which is called cremaster muscle. Cremaster muscle is the skeletal muscle that is innervated by the genitofemoral nerve that we are going to discuss in the nervous system, and it's the corresponding of the internal oblique abdominis muscle and transversalis abdominis muscle. And then finally, after the transversalis abdominis muscle, we have another fascia, which is number 7 here. And this fascia, if I continue toward the scrotum, is this green fascia, which is called internal spermatic fascia. And this is corresponding to the transversalis fascia, and another name for transversalis fascia is the endoabdominal fascia as well. And finally, the most deepest structure inside the abdominal cavity, after you dissect all this layer, you will reach to the peritoneum. And peritoneum, the remnant of the peritoneum in the scrotum, if you remember, we said that it's making the tunica vaginalis. And tunica vaginalis has a parietal layer of the tunica vaginalis, which is called periorchium, and the visceral layer, which is covering the tunica albuginal, the surface of the testicle, which is called the epiorchium, and between them is the serous cavity of the scrotum, that sometimes in disease it can accumulate the serous secretion, which is called hydrocele or hydrocella. So this is all about the layers of the abdominal cavity and layers of the scrotum that there are. You have to find the corresponding layer, and it's very important. For each layer in the scrotum, we have the synonym name for the anterior abdominal wall, or vice versa. You will be given as a this one of the layer of the abdominal wall, and you will be asked the synonym of corresponding layer inside the scrotum. What is the name? Regarding the cremaster muscle and tunica dartus, that they are the muscular layer of the scrotum, they are very important by their contraction. They are regulating the temperature. And this is important. For sure you have experienced that if the weather is so cold, these muscles, the cremaster muscle and tunica dartus, they are contracting, and the scrotum is elevated upward and it's contracted. So in this case, the surface of the skin of the scrotum, it's becoming decreased, and then they are saving the heat inside the scrotum, and in this case they are regulating the temperature inside the scrotum. Vice versa, when the weather is so hot, you see that the scrotum, these muscles, they are relaxed, and the scrotum is going downward and is loosened. And in this case, the surface of the skin, it will be increased, and also they are dilating also the vessels around the skins, and in this case the losing of the heat, it will be much more suitable and easy. And in this case also, in the case of the warm and hot weather, so you can rapid, or you can do the process of the losing of this heat and regulating of the temperature most rapidly and quickly happening by the increasing of the surface of the skin via this action of this cremaster muscle and tunica dartus. And also to see if this level or this innervation of these muscles that are working. So if you make the pain in the inner surface of the upper thigh region or femoral region, so if you make a pain in this skin of this part of the thigh or the femoral region in the inner surface, you can see by the producing of the pain, the cremaster muscle is contracting and the testis, it will be elevated upward, and this is called cremasteric reflex, that it can be examined by the doctor to see if the innervation of the genitofemoral nerve is intact or not. So back to the place that we finish, epididymis, the tail of the epididymis is finishing, and another part of the pathway of the sperm, which is called ductus deferens, is starting. The ductus deferens is approximately, is variable. Some literature they call it 40 centimeters, some literature 60 centimeters. So approximately between 40 to 60 centimeter. The diameter is 3 millimeter. The lumen that it has 0.5 millimeter. The diameter that the sperm is passing through this lumen toward the prostatic part of the urethra. So as a matter of fact, this ductus deferens, it's the place that it's connecting the epididymis to the prostatic part of the urethra, respectively the colliculus seminalis, the place that we are going to discuss. It's the function of the ductus deferens, and in the beginning it's the convoluted part, and then it's becoming as a straight. So during to its pathway, the ductus deferens has different part. This part that is parallel with the epididymis, it's passing superiorly, is called the scrotal part, or it's called epididymic part of the ductus deferens. So this is according to the pathway of epididymis or the scrotum. Then the ductus deferens is entering to the structure which is called spermatic cord or funiculus spermaticus. Funiculus spermaticus or spermatic cord part. So it's going together with the vessels that I'm going to discuss about the structure of the spermatic cord. Then it enters to the inguinal canal. So here is called the inguinal part of the ductus deferens. So till now we have epididymic part or scrotal part, the part of the spermatic cord part or the funiculus spermatic part. Then it enters to the inguinal canal, and it continues under the peritoneum, the pelvic part inside the lesser pelvis, and it's located under the peritoneum. Very important, as we mentioned, it is crossed by the ureter, and as you see, ureter is going under and is crossing the ductus deferens. Synonymous for here, it's the ureter is crossing the uterine artery in female. Then the next part, so this is the pelvic part of the ductus deferens, and the next part is here, this part that is becoming dilated and is called ampulla of the ductus deferens, and this is the widest or widening part of our widening end of the pelvic part of the ductus deferens, that it's located behind of the and below the urinary bladder, the fundus of the urinary bladder, and it's joined with the duct of the seminal vesicle or vesicula seminalis, is another gland that it's secreting the seminal fluid. It has a duct which is called the excretory duct, and this excretory duct of the seminal vesicles, it's connecting with the ampulla of the ductus deferens, and they make the duct which is called ejaculatory duct. And this ejaculatory duct from the superiorly and posteriorly, it going downward and medially, and it open to the male urethra, the prostatic part of the male urethra, which is called the widening part, which is called colliculus seminalis, that I'm going to discuss. So, according to each pathway, as you see, we have several parts. The scrotal or epididymic part, the part of the spermatic cord, the part inside the inguinal canal, the pelvic part under the peritoneum, and then the ampulla of the ductus deferens, which is joining with the excretory duct, which is duct of the vesicle seminal, and together they form the ejaculatory duct that is open to the male urethra. So regarding the structure of the ductus deferens, we said that the length is approximately 40 till 60, is variable. The diameter is 3 millimeter, so the lumen is approximately 0.5 millimeter, and it composed of very strong muscular compartment. So from the inner surface, if you look, so here first layer is the mucous membrane, which is composed of the epithel and some folds, and then after that it's composed of the lamina propria, which is contained of the elastic fiber. Then after that you can see this three layer of the muscular layer. So the muscular layer of the ductus deferens, they have three layers, and the inner and the outer layer, they are the longitudinal, and in the middle layer it's the circular layer. So inner longitudinal, circular, and outer longitudinal, and finally the outer layer is the adventitia, which is the connective tissue that is covering the ductus deferens. So here in this cross section you can see very nice. So this is the lumen of the ductus deferens, and it is covered by the mucous membrane and lamina propria. This is the longitudinal layer, then is circular layer, and then there is longitudinal layer, and then the adventitia that you can see it in this area. So this tri-layer of or three layer of the muscular compartment, it's very important for the contraction of the lumen of the ductus deferens, and in this case they make the peristaltic, it has a peristaltic character like an intestine, and it's moving the sperm toward the prostatic part of the urethra. And as far as we are reaching toward the ampulla of the ductus deferens, which is the widening end of the pelvic part of the ductus deferens, then this three layer it's disappear, and it's just remaining the longitudinal layer of the muscle in the ductus deferens, and this is helping for the emission, this peristaltic character of the movement. Thanks to this three layer, they are moving the sperm toward the prostatic part of the urethra, and this is called the emission of the sperm, and this is controlled by the autonomic nervous system, and respectively is the sympathetic innervation is caused the emission of the sperm from the ductus deferens toward the prostatic part of the urethra, and is ready for the ejaculation. That the ejaculation also is controlled by the sympathetic innervation. So here we have the spermatic cord or funiculus spermaticus. It's the structure that, as we said, the ductus deferens, it's from the cauda, it continues and it goes to the inguinal canal. This part from the cauda of the epididymis, it means that the scrotal part or epididymic part till the entrance to the inguinal canal. The ductus deferens is inside the spermatic cord after the passing from the epididymic part or the scrotal part. The layer of the spermatic cord is more or less is the same as layer of the scrotum, but of course here we don't have the skin. and the tunica dartus. We have the external layer, which is here is the external spermatic fascia. Then is followed by the cremaster muscle, which is, as we said, is the continuation of the internal obliquus internus abdominis muscle and the transversalis muscle with its fascia. This is the fascia that is covering the cremaster, and finally the internal spermatic fascia. So those are the layers that they are covering the spermatic cord. And here also we don't have the peritoneal layer or the tunica vaginalis. It's just a remnant of the peritoneum, which is called vestigium of the processus vaginalis, or the vestige of the vaginal process, which is the remnant of the vaginal process of the peritoneum. So the content of the spermatic cord is important also, as we mentioned it already. So the ductus deferens is the largest content of the spermatic cord. That parallel with the ductus deferens, you can see the artery of the ductus deferens that is supplying the ductus deferens. And also parallel with the artery, you can find the nervus plexus, mainly the sympathetic nervus plexus that is parallel with the artery, the wall of the artery it passes also. Another component of the spermatic cord is the testicular artery. This is the testicular artery that we already mentioned is arise from the abdominal aorta, from the both sides, and synonymous of this artery is ovarian artery, that in female. But this testicular artery parallel with the wall of the testicular artery also it passing the nerve plexus, which are the sympathetic nervus plexus, which is called testicular sympathetic plexus, parallel with the wall of this artery that here is not mentioned. And this bluish plexus of the veins is called pampiniformis plexus or pampiniform plexus, venous plexus. This is the plexus which is passing inside the spermatic cord, and it's the venous plexus and is not nervus plexus. And finally, we have inside the spermatic cord the lymphatic vessels. Lymphatic vessels inside the spermatic cord. So those are the layers and the content of the spermatic cord. Once more, quickly, the layer external spermatic fascia, cremaster muscle with its fascia and internal spermatic fascia, without skin and without tunica dartus, and without the peritoneum tunica vaginalis, just the remnant which is called vestigium or vestige. Then the content of the spermatic cord, ductus deferens, the artery of the ductus deferens, and the plexus deferentialis, or the nervus plexus, which is passing parallel with the artery of the ductus deferens, testicular artery, and the nervus plexus, or the nerve plexus, testicular nerve plexus, which is a sympathetic parallel with the testicular artery, the pampiniformis plexus, the venous plexus that we already mentioned, and the lymphatic vessels. And it might be the peritoneum does not exist, just a remnant which is called vestige or vestigium of the processus vaginalis or vaginal process. So here you can see the testis inside the scrotum, and we open the scrotum and you see the testis, both testis. This is the testis or testicle that it's cutted, and it's showing the tunica albugina, and here there are the lobules of the testis and or testicle and septuli or tunica erythroida. What I wanted to show you here, it's the spermatic cord or funiculus spermaticus that we already mentioned in the content, and layer. So the layer was the external spermatic fascia, cremaster, and the internal spermatic fascia. And the content, if you touch it, I'm touching here the most posterior structure, which is here. It's and the thickest structure that it already you can touch it and palpate it. It's here. It's the ductus deferens that is located posteriorly in the content of the ductus deferens, together with the arteria of the ductus deferens and the plexus sympathicus, or the sympathetic plexus, the nerve plexus, parallel with the wall of the artery. Another structure that is anterior to that is here, and it's the testicular artery. It's passing through the ductus deferens, through the spermatic cord, and also the venous plexus, the pumpiniform venous plexus, parallel with the wall of the testicular artery, past the nervus plexus, the sympathetic nervus plexus, the testicular sympathetic nervus plexus, and some lymph vessels, and the remnant of the peritoneum, which is called vestiges or vestigium of the tunica vaginalis. So here it's the structure, and if I go through the details of the scrotum, as you see here, it's the scrotum, is the skin of the scrotum, as I said, is pigmented, the skin is thin, and it has a lot of fatty tissue, the sweat gland and the sebaceous gland, the hairs, and the first layer, it is the skin, and then it's synonymous with the skin of the anterior abdominal wall. Then if I put it away, and under the skin you can see the muscle, this brownish color that you see is the smooth muscle. It's called tunica dartus, which is the synonymous in the anterior abdominal muscle. Its wall is the Scarp's fascia, and it's the function together with the cremaster muscle for the regulation of the temperature inside the scrotum, which is 2 degrees of Celsius, is lower than the body temperature. And then if I go further, you can see the fascia, the internal spermatic fascia, the external spermatic fascia, which is synonymous in the anterior abdominal wall, is the superficial abdominal fascia, which is covering the external obliquus abdominis muscle. And then you reach to this muscular layer, which is called cremaster. This cremaster is synonymous in the anterior abdominal wall with the obliquus internus abdominis muscle and transversalis muscle. And then after the muscle, you have the internal spermatic fascia, which is synonymous is the transversalis fascia or endoabdominal fascia, and finally the tunica vaginalis that already we mentioned it, the epiorchium, the periorchium, and then epiorchium, and here you can see the tunica albuginum. And then of course you can see this, the epididymis, the head, the body and the tail, and from the tail it continue again. You can see the spermatic cord or folliculus spermaticus, that it has the similar layer as you see here, except the skin and except the peritoneum, and those are the structure that they pass through the spermatic cord. The most posterior structure and thickest structure here is the ductus deferens, and anteriorly is the testicular artery, and the rest they are already mentioned in the theory. So next part of the internal male genital organ, which is the gland, is the seminal vesicles or vesicula seminalis. These glands, they are the paired glands that they are located behind the urinary bladder, respectively behind the fundus of the urinary bladder, and it's passing the laterally and cranially from the ampulla of the ductus deferens. So very important to recognize in the dissection or in the picture, because they have similar shape. So the seminal vesicle or vesicula seminalis is located laterally from the ampulla of the ductus deferens, which is the end part of the pelvic part of the ductus deferens. And here is the ureter, which is crossing the ductus deferens. Here is the peritoneum, and here is the region of the fundus of the urinary bladder, which is between the ampullar part of the ductus deferens. Is called interampular trigone of the urinary bladder. It's the place. The position of this seminal vesicle, which is the length is approximately 4 till 5 centimeter. The width is approximately 1.5 till 2 centimeter, and the diameter is more or less 1 centimeter. Itself, it has the coil-shaped duct that it's this coil-shaped duct. It's around 12 centimeter, and it's called excretory duct. And this excretory duct is joining with the ampullar part of the ductus deferens, and they form the ejaculatory duct that is open to the colliculus seminalis, the widening part of the prostatic part of the male urethra that I'm going to discuss. So the function of this seminal gland or vesical gland, it's approximately is producing 60% of the seminal fluid, and this secretion during to the ejaculation, it's gelatinous. It has a gelatinous consistency. It's the color is approximately pale yellowish color, and is a little bit alkaline in pH to neutralize the acidic environment of the vagina when the sperm and ejaculatory fluid is entering to the vagina. Also, it's containing of the protein like a globulin, and it contains vitamin C, fructose for the energy of the sperm to continue the passage of the sperm inside the urinary tract as well. And also it contains prostaglandin that is stimulating the smooth muscle of the vagina, and in this case the contraction of the muscle, and in this case transmission of the sperm further toward the uterus. So the position of this, as we said, this vesicula seminalis is behind the fundus of the urinary bladder. It's between the rectum and the urinary bladder, and as we said that it's the pouch or excavation, which is called the rectovesical pouch, and sometimes the tip of this vesicula seminalis is reached to this rectovesical pouch. And this is all about the structure that we have. It's covered by the outer layer is covered by the adventitia, so it's the structure that is below peritoneum. So it's the structure which is called infraperitoneal organ, or also the extraperitoneal organ as well can be considered. Next part is prostate. Prostate is another gland of the male genital organ. Is located below the urinary bladder and is pierced by urethra. So here is the piercing of the urethra. The shape is and the size is approximately is the size of the chestnut, and it has, as we mentioned, it has two basic parts. The part that is toward the urinary bladder is called base. It's the place that is going superiorly and posteriorly, and it's determined as a part of the prostate gland that is attached to the urinary bladder. And from the neck of the urinary bladder, the urethra, it's continue to the or enter to the base of the prostate, and then it's the second part, which is called apex of the prostate, which is directed anteriorly and inferiorly, and the tip of the or apex of the prostate, it's reached to the urogenital diaphragm, which is the transverse perineal muscle, the deep and superficial and external urethral muscle. So this is the part that is vice versa of the urinary bladder, that the apex is going the antero-inferiorly and it's surrounding the urethra. The urethra, when it passes through the urinary through the prostate, is the position of the urethra. It's more close to the anterior wall of the prostate, and in this case, the prostate, it's divided to two main parts: the periurethral part, the part of the prostate that is in front of the urethra, and since the urethra is located more to the anterior wall of the prostate, this part is smaller than the part that is behind the urethra, the male urethra, which is called the retrourethral part of the prostate. So the position and the location of the prostate is in front of the anteriorly. It has the anterior surface, which is toward the symphysis pubis, and it's connected by the ligament, the puboprostate ligament, and the muscle, the puboprostatic muscle. It's connected to the symphysis pubis. Posteriorly, it's the posterior surface or rectal surface, which is toward the rectum, and also it's palpable by the anal examination, approximately below the chlorage fold or the transverse rectal fold on the right side. So this is the place that the prostate is located. As you see, here is the vesicula seminalis. This is the ampulla of the ductus deferens. Be careful, vesicula seminalis always laterally, ampulla is always medially. They are paired here, ampulla, ductus deferens, and here vesicula seminalis. Here is the base, that is the place that the prostate, it's attached to the urinary bladder. This is the entrance of the urethra from the intramural part, which is here is the urinary bladder. So intramural part, it's going to the prostate here as a prostatic part of the urethra, and then go inferiorly and anteriorly toward the apex here, as you see, and it's coming out, and it continues the male urethra to the urogenital diaphragm as a membranous part here. So if I open the urethra, if I open the prostate and look at the prostatic part of the urethra, the male urethra, you can see the crest here, which is called urethral crest. This urethral crest is it's seen in the prostatic part of the prostate of the urethra. And you can see the widening part here, which is called colliculus seminalis. This colliculus seminalis is important because it's inside. You can see the two orifices here inside the colliculus seminalis. These two structure, those are the opening of the two ejaculatory duct that it's going and is opening to the colliculus seminalis. It means that the widening part of the prostatic urethra. And also you can find here in the middle this part which is called utricle or utriculus prostaticus. It's the rudimentary part from the Miller duct embryonic structure, and is usually the blind opening. Then in the side of the urethral crest, which is here, you can see the part which is called prostatic sinus, and through this prostatic sinus it opens the prostatic glands. So as you know, the prostate, it has approximately 30 till 50 tuboalveolar glands that they are secreting approximately the 15 till 30% of the ejaculatory fluid, and this fluid is colorless. Usually it contains zinc, it contains the vitamin C as well, prostaglandin protein like immunoglobulin. It contains the spermine, is the structure that it's for the motility of the sperm, and it's important. And also the prostate is very sensitive organ to hormones, and in old people you can hear about the hyperplasia of the prostate, which is happening usually in the periurethral zone or transitional zone, happening that it's by the enlargement of this zone around the urethra here, so it can press the urethra, the male urethra, and it make the problem with the micturition, and I'm going to discuss about this, and this is called the hyperplasia of the prostate. So this is about the outer structure of the prostate and the function of the prostate, and then we are going to discuss the structure inside, about the lobes and the zones of the prostate. So once more, very important is that the ejaculatory duct, they are open to the colliculus seminalis. In the widening part of the prostatic part of the urethra, and in the side of the urethral crest here, there are the place which is opening the prostatic glands, and this place they are called the prostatic sinus. It's called, and it's the place for the opening of this tuboalveolar prostatic glands. So as we said that the prostate, the tip of the prostate, it goes downward and anteriorly toward the urogenital diaphragm, and in this case the prostatic urethra of the male, it continue as a membranous part of the urethra toward, which is passing through the urogenital diaphragm. And here is the ejaculatory duct, which is formed by the junction of the excretory duct of the seminal vesicle and the ampulla of the ductus deferens, that it's going from the superior part and posterior part toward the anterior part and inferior part and medially, and is open to the colliculus seminalis, the opening of the ejaculatory duct. Here in this picture you can see the cross-section, transverse cross-section through the prostate, and it's the view from the above. So it means that here is the anterior part and here is the posterior part of the prostate, or anterior surface, posterior surface of the prostate. Here it's the urethra, is the prostatic part of the urethra, which is more close, as we said, is more close toward the anterior wall, nearer than the posterior wall. So in this case, this anterior side is the periurethral part of the prostate, and here is the post or retrourethral part of the prostate. It's very important to know that the prostate is covered by the capsule, which is called the proper capsule of the prostate. This is the prostate, the proper capsule. Then outer part of the proper capsule, this bluish structure that you can see, those are the venous plexus. Those are called prostatic venous plexus. That it's after the proper capsule of the prostate, and then outer of this venous plexus also is enclosed by this capsule, which is called the periprostatic capsule. And this capsule is the part of the visceral layer of the pelvic diaphragm. Also is also considered. So this is the structure that you can see in this periprostatic capsule and the proper capsule. So once more, we have two layers of the capsule. One in the surface of the prostate, which is called prostate capsule, and then is the venous plexus, and then it's the periprostatic capsule or prostatic capsule. Then the place that exactly, the narrow place that is exactly in front of the urethra, the prostatic urethra, this part is called isthmus. The isthmus of the prostate, it's the middle part anteriorly in front of the urethra, which is the character of this part, it doesn't have any gland. So this isthmus, it doesn't have any gland, it's just made by the connective tissue and the muscle. General structure of the prostate, it's composed of glands, it's composed of the connective tissue, and it's composed of the smooth muscle. So this isthmus part, it doesn't have glands. Then regarding the lobes of the prostate, the prostate usually it has 5 lobes. The left lobe, the right lobe, the anterior lobe and posterior lobe, in front and behind the urethra, and then this part, which is a little bit is marked as a black, it's the middle lobe of the prostate, or lobus medius. It's the elevated part of the prostate, which is located between the urethra and the passage of the ejaculatory duct. This part, this middle lobe, is very sensitive to the hormone, and that's why it's becoming enlarged. So it's making the hypertrophy of the prostate, and in this case, it's pressing the lumen of the urethra, and it can cause the closure of the orifice of the urethra in this case. So those are all about the lobes and the capsule of the prostate, and then about the zones of the urethra, the prostate, which are clinically important. So according to the clinical aspect, the prostate is divided to the different zones. This is the cross-section through the prostate to determine the zones of the prostate. So here you can see the dorsal surface, and here is the ventral surface, and here is the view from the side, which is showing the dorsal surface and the ventral surface. So if you see that here it's the urethra, so this is the prostatic part of the urethra, and here is the place of the isthmus, the prostatic isthmus. So this area that is around the urethra, it's located, and it contains the mucous glands, and it's exactly around the urethra is located in the cranial 2/3 of the prostate above the colliculus seminalis. So this is called the periurethral zones. These periurethral zones, as we mentioned, and here you can see also, it's contain the 5% of the glands of the prostate, which is called the mucous glands. So this is the urethra, the periurethral zones. And then behind the periurethral zones, there is this reddish part, which is called the central zones. This central zone is containing submucosal glands. The submucosal glands, they are the place, and the central zones, they are the place that is exactly behind the periurethral zone is located, and it's the place that the ejaculatory duct is passing. This is very important. and in this case they are behind and a little bit on the side of the periurethral zone is located, and it contains the submucosal glands, and it contains approximately 25% of the glands that the prostate has. And then here, which is the largest part of the the prostate, which is called peripheral zones, and this peripheral zones is surrounding the central zone from the posterior side, and also from the side, the lateral side or both sides is surrounding the central zone, and this is the part of the prostate which is approximately contain the 70% of the content of the prostate, and they contain the main tuboalveolar glands, the main glands of the prostate, that they are producing the prostatic secret via the prostatic ducts, which are in the number, they are variable. So this is the peripheral part of the, or peripheral zone of the urethra, which is main carcinoma of the prostate. It's happening usually in the prostatic part. And finally, we have one small part that is called transitional part. Transitional part is near to the periurethral zone, or transitional zone is near to the periurethral zone, and it's on the side of the periurethral zone, between the periurethral zone and the peripheral. So here it's the part of the transitional part, and it's, as a matter of fact, it's the zone that is between the zone of the peripheral zone and the periurethral zone is located. So this is the transitional zone. So here we have, again, for recapitulation, in this cross section you can see periurethral and also a part of the transitional zone. Then you have the central zone, which contains the submucosal gland. Here the periurethral zone, it contains the mucous gland, and then you have behind the central zone, and the side of the central zone is the largest part, which is called peripheral zone, and the most cancer of the prostate is happening in this area. So as we said that the ductus deferens, after is going to the funiculus spermaticus or spermatic cord, then it enters to the inguinal ligament, inguinal canal, and then it goes to the pelvis as a pelvic part, and the end of the pelvic part is this part, which is the widening part of the ductus deferens, which is called ampulla, and lateral to that it's the seminal vesicle, or vesicula seminalis, is the gland that is producing 60% of the seminal fluid. As I mentioned, be careful, here is the ampulla of the ductus deferens, and here is the vesicula seminalis. Vesicula seminalis is always laterally to the ampulla of ductus deferens. So here, if you look at it in other preparation that in a while I'm showing you. Here is the prostate, and the prostate, as I said, is the main gland of the male genital organ. That it's the size is approximately is like a chestnut, and as I said, this base of the prostate is going toward the wall of the urinary bladder, the fundus, the posterior wall of the urinary bladder, and here is the apex of the prostate, which is the urethra is coming out of the apex of the prostate. So the dorsocranially is the base of the prostate, and anteriorly and inferior is the apex of the prostate, which is toward the urogenital diaphragm. It's going. So this is another preparation, and the posterior view toward the urinary bladder. Here, this is the ureter, and this is the ureter, and they are the place that the ureter from the posterior side and the superior is going downward, and it going to the fundus of the urinary bladder in the posterior side. And in the posterior aspect of the urinary bladder, here you have the prostate, And here you can see the ampulla of the ductus deferens, and lateral to that it's the vesicula seminalis, the gland here. The ampulla, the other ampulla here is cutted, and here is the vesicula seminalis that is located in the posterior aspect of the urinary bladder between the prostate and the urinary bladder here. And here is the base of the prostate, and here is the apex of the prostate that is going anteriorly and inferiorly, and here is the urethra, the prostatic part of the urethra that is coming out, and it continues to the urogenital diaphragm as a membranous part of the urethra. So this is the anterior aspect, urinary bladder here with the fold of the urinary bladder, and here is the opening of the urethra inside the prostate, which is the widening part. It is here it was in the center, it was the structure which was called the colliculus seminalis, and the colliculus seminalis, and above and below it's the urethral crest, and this is the colliculus seminalis was the place for the opening of the ejaculatory duct, and lateral to that it's the prostatic sinus, which is the place for the opening of the prostatic gland. And here is another preparation. You can see again, be careful, laterally vesicula seminalis, medially ampulla of the ductus deferens, and laterally the vesicula seminalis here. The base of the prostate and apex of the prostate from the opening, you can see the fibrostromous structure of the prostate gland. The prostate gland, the structure contains, as we said, the glands, the connective tissue, and the smooth muscle. And finally, here is very nice preparation. You can see again the urinary bladder here. The apex of the urinary bladder is directed superiorly and anteriorly, and the base and the fundus it's located posteriorly and inferiorly, and between them it's the widest part, which is the body of the urinary bladder. And if I open it here, you can see the folds of the urinary bladder, very nice, and musculus detrusor, the three-layer muscle of the urinary bladder, and this part that it's the vesical triangle, which is made by the interureteric fold, and the apex is the internal urethral orifice that already in the urinary system we discussed it. And it doesn't have the fold because the mucosal layer is firmly attached to the muscular layer. And in this area, if you go here, the urethra, it's passing through the wall of the urinary bladder, and then it's from internal urethral orifice in male, it goes as an intramural part through the wall of the urinary bladder, and it enters to the prostate as a prostatic part of the urethra, becoming enlarged, and then finally through the apex is coming out toward the membranous part of the urethra to the urogenital diaphragm. This size of the prostate, it's enlarged, it's not normal, and this is called hypertrophy of the prostate, that you can increase by the size by the influence of the hormones. And here is the anterior aspect, and here is the base again, and here is the apex. And in posterior aspect, if you see, very nice, you can see the passage of the ampulla. This is the typical picture of the this is the ductus deferens, and here is the ampulla, the widest part of the end of the pelvic part of the ductus deferens here, and lateral to that is the vesicula seminalis, which is seen here. Here is the another ampulla, and the vesicula seminalis here is cutted. And very important also, it's the ductus deferens here that is crossed by the ureter, and ureter, it goes underneath of the ductus deferens, it's crossed under the, and it passes under the ductus deferens in female uterine artery, the place that the bowels lymphatic tissue is located. So here is the posterior, and it's very nice preparation again in this part. Regarding the male urethra, we already discussed about the female urethra, and now we have the male urethra that as I said, it's a little bit more complicated because this passage of the urethra is not only the passage of the urine, but also is the passage of the sperm and ejaculatory fluid. So the male urethra, we divide them to several parts. Here, the first part that is starting from the vesical trigone, at the apex of the vesical trigone, which is called the internal urethral orifice, and then it continues to the wall, through the wall of the urinary bladder as a intramural part, which is approximately half a centimeter is the length. Then, as we already said, it's entered to the prostate as a prostatic part of the urethra, that it has the enlargement, which is called culiculus seminalis, that there it opened the ejaculatory duct, and then behind of them in the middle it's the utricle or utriculus prostaticus, which is the blind sac that is a remnant of the Miller duct. Then after the prostate it enter and it passed through the urogenital diaphragm here, that it's called the membranous part. The membranous part of the urethra. The prostatic part of the urethra is approximately 3 till 4 centimeter, and the membranous part of the urethra is approximately 2 centimeter, passing through the urogenital diaphragm. And then it enters to the spongy part of the penis. So that's why this part of the urethra is called a spongy part of the urethra, which is approximately 15 centimeters in its length. So the main four part of the urethra is intramural, prostatic, membranous, and the spongy part of the urethra. So totally, of course, is variable, but totally the average length of the urethra from the beginning, from the internal urethral orifice till the external urethral orifice is approximately 20 till 22 centimeter. So during to this its pathway, the urethra, the male urethra, it has in some place widening part or widening part, and in some place the urethra is becoming very narrow. So those are called, according to the passage of the urethra, the narrowing part of the urethra and widening part of the urethra. That is important. That usually the urinary stone it can be trapped in this area. So regarding the passage of the urethra, the widening part of the urethra, one is in the prostatic part. The other widening part of the urethra is at the beginning of the spongy part, which is enter to the spongy part of the urethra, which is called the ampulla, urethral ampulla. And then the other part, which is the widening part of the urethra, is approximately 2 centimeters behind the external urethral orifice, is this area which is called navicular fossa or fossa navicularis urethrae, and this is the urethral dilation of the proximal to its external orifice is a little bit 2 centimeters behind the or proximal to the external urethral orifice. So these three places the urethra is becoming enlarged or wide. The rest of the part, they are the narrowing part of the urethra, that the urinary stone it can be trapped in this area. Regarding the navicular fossa, it's important that because in the superior part it has a recess, which is blind recess that just present at the superior margin of the navicular fossa. So it's important during to the passage of the sonde or catheter. Here, remember for this recess, which is if you press it, so it will be a lot of pain or it will be painful. The narrowing place of the urethra is internal urethral orifice, intramural part, the membranous part, and it passes through the urogenital diaphragm, most of the part of the spongy part of the urethra, and finally the external urethral orifice. The external urethral orifice, you see that the vertical opening, that it's the opening. This opening is placed vertically. Before that, in the spongy part and most of the spongy part, this opening or the lumen of the urethra is it's in transverse direction, and in the place of the membranous part, for example, the place that is passing through the urogenital diaphragm is star shape, and also at the level of the colliculus seminalis, the prostatic part, this cross section of the lumen of the urethra, is a curved shape. It is. So this is about the different part of the urethra and narrowing place and the widening place of the urethra, that it's very important. So the last part of the internal male genital organ or gland here, it's this gland, which is called bulbourethral gland or Cowper's gland. This gland is located between the membranous part of the urethra and the ampullar part of the urethra. It means that it's located under the urogenital diaphragm and in the initial part of the spongy part of the urethra, which is the ampullar part, the widening part it is. It has approximately or almost, it's 3 centimeter or 2 centimeter length duct that it has, that the structure is tubo-alveolar gland that they secrete the very sticky secrete, that it's the function is the lubrication of the surface of the urethra during the ejaculation. And so in this case is lubricating and is facilitating the ejecting and ejaculating of the ejaculatory fluid containing the sperm from the urethra. So this is the bulbourethral gland or the Cowper's glands. So, and the last part of the genital organ, which is belong to the external genital organ. One external genital organ was scrotum that already we discussed, and another part of the external genital organ is penis. Penis has several parts. This part that is paired is called the root of the penis, or the root of the penis, or the radix of the penis, which is composed of the crura of the penis or crux of the penis, and it's made by the cavernous body or corpus cavernosum, which are paired. This is that you can see just the one side of this, and they are separated not completely by the septum of the penis or pectiniform septum, not completely from each other. So this is the first one. Then the second part, it's the corpus of the penis. This is the body of the penis. The body of the penis is directed from the radix anteriorly, and it has 2 surfaces. This surface is the dorsum of the penis, and this surface, which is the urethra, that it passes through the spongy part of the penis. So it's near to this surface, so that's why this inferior surface is called the urethral surface. After the body. So then we have the column or neck of the penis, which is the transitional part between the body and this part, which is called glans penis. The glans penis is not completely covered by the skin, because the skin of the penis, as you know, it's pigmented, and also it contains the hair called pubis, and also at the level of the border between the glans penis and the body, which is the neck, here is the corona of the glans penis, and in this area the skin is finishing is covered by the thin layer of the skin, very thin, and under that it's very rich. It has a very rich blood supply, and it's very sensitive. So it has very rich sensitive innervation in this area. So at the region of here, the corona of the glans penis, so the skin, it's become duplicated, which is called preputium, or the foreskin is English terminology, and it's in some case that it's preventing and is disturbing the urination, and sometimes also, according to the religion, also it's removing this foreskin. It's called circumcision. It happening in some country also as a rule or as a tradition. This is that this foreskin, sometimes it can make problem, because during to the erection, so this attachment of the foreskin toward the column or corona of the glans, so it's staying, and it's allowing the enlargement of the penis during the erection, or also during the micturition. And this foreskin also contains a lot of sebaceous gland, which is called the glandula preputialis, or the sebaceous gland of the corona, that it has a secretion which is called smegma, and sometimes it can change to the some malignancy, so that's why preventively it can be circumcision happening in this part of the penis. Then, of course, this preputium has in this area frenulum, a small fold of the skin that it's on the surface or in the lower part of the glans penis. It's located. The penis is fixed to the via two ligaments. One ligament which is not shown here and is superficially is called the fundiform ligament, and this fundiform ligament, it's the superficial more is made by the elastic and is connected to the linea alba abdominis, the white line in the midline of the abdomen. It's the linea alba, and the other ligament for the fixation of the penis is this part, which called the suspensory ligament of the penis. It's the deep part, and it's attaching the anterior surface of the symphysis pubis to the deep fascia of the penis, and this is called suspensory ligament of the penis. During to the passage of the urethra inside the spongy part, as you see, the penis has two curvature. First curvature, which is going anteriorly and cranially, this curvature, it's called subpubic curvature. And after it reached to the place of the pubic bone, which is here. Then it's going downward and anteriorly, which is called the peripubic curvature. And this peripubic curvature during the erection, it will be disappearing. So the subpubic curvature is always constant and fixed, but the peripubic curvature, which is in front of the and below the pubic bone, it's during the erection it will be disappear. So in this case is not constant. The corona or the crus or the root of the penis, which is made by the crus or crura of the penis, which is paired, is fixed to the inferior ramus of the pubic bone, which is called crista phallica. That we already we mentioned it during the bone of the lower extremity. So the structure of the crura of the penis, that we said that it's made by the cavernous body. Those are the endothelial space, or is the space that it's filled by the blood, and it's called cavernous body. And to these spaces or endothelial space, they are passing the branches of the deep artery of the penis, which is called helicina artery, and via and during the erection, it means that erection is it's influenced by the parasympathetic, so it's filled by the blood of the arteria helicina, which is the wavy-shaped arteria. It's wavy-shaped because during the extension of the penis during the erection, it has a reserve for the extension of the artery as well. So that's why they call it a helicina or wavy shape. And under this artery, we have the smooth pad, which is called Ebner's pad. It's the smooth muscle that they are contracting and relaxing, and in this case, allowing the blood to go to this cavernous space or the cavernous body or endothelial space, and during the erection via the parasympathetic, the blood is filled by these spaces. This cavernous spaces is filled by the blood, and the size of the penis is enlarged, and vice versa. After the erection, the size of the penis has become small because the veins or blood, they are going via the veins through the veins or the art, and the blood is emptying from these spaces or the cavernous spaces. The crus or crura of the penis or cavernous body is superficially covered by the muscle, which is called ischio-cavernous muscle, and the bulb of the penis, which is the beginning of the spongy part of the penis, which is unpaired and is made by the spongy part, and is surrounding the urethra, as we mentioned it. So the urethra is passing through the spongy part of the penis. So it's toward and is lying on the urogenital diaphragm. So the two cross or crura of the penis is separated from each other by the septum of the penis, which is not completely separated. That's why this septum is like a comb-like wall that separates left and right cavernous body. That's why they call it pectiniform septum. So this is all about the macroscopical part of the penis, and then I'm going to discuss about the cross section of the penis. So here is another picture of the external genital organ of the male, which is penis. Here you can see the glans penis, and here is the unpaired part of the spongy part of the penis, which is the corpus spongiosum is called. And on the surface of the corpus spongiosum there is a muscle superficially, which is called bulbospondiosus muscle, musculus bulbospondiosus. And here, vice versa, there are paired structure which is called cavernous body or corpora cavernosa, that they are continue as a crura of the penis or root of the penis, which is attaching to the crista phallica, and superficially is covered by this externogenital muscle which is called ischio-cavernous body. This bulb of the penis from the spongy part is lying on the urogenital diaphragm, and in this place between the urogenital diaphragm and the ampulla, it's the Cooper's gland or the bulbourethral gland that you can see, and here you can see the pubic bone which is attaching the ligament, suspensory ligament of the penis to the deep fascia of the penis. Now the cross section of the penis. So, if we do the incision through the penis and to have the transverse or horizontal section of the penis, you will see this picture. So, this picture is showing you the structure that you can find it inside the penis. So, on the surface of the penis, you can see the skin. Already we said the skin of the penis is pigmented. It contains the sweat glands and the sebaceous gland and some hairs. Then under the skin we have this green layer which is called the superficial fascia of the penis. The superficial fascia of the penis under the subcutaneous connective tissue that we have it under the skin, and after that we have the deep fascia of the penis. Deep fascia of the penis. Between the superficial fascia of the penis and the deep fascia of the penis, you can find the superficial vein of the dorsum of the penis that sometimes is paired and sometimes is unpaired. Then you will reach to these two structure that it's the corpora cavernosa or cavernous body, that we said that it's separated by the septum, not completely by the septum of the penis or pectiniform septum. And inside of this corpora cavernosa that we already said about the structure, it's the deep artery of the penis. This is also it's seen, and between the deep fascia of the penis and the tunica albuginea, which is covering the corpora cavernosa, here you can see the deep vein of the dorsum of the penis, artery of the dorsum dorsalis penis, and nerves of the dorsalis penis you can be found. Then in the urethral surface, this is the dorsum of the penis, and this is the urethral surface of the penis. So in the near to the urethral surface, you can see the spongy body or corpus spongiosum, and inside the corpus spongiosum, as we said, definitely we will have the urethra, the spongy part of the urethra, almost 15 centimeter in length, and in both sides you can see the urethral artery that they are supplying the urethra, the spongy urethra. So this is the cross section of the penis. The tunica albuginea and the spongy part, it's not that much seen and well seen like the corpora cavernosa. It's important, and in next picture I'm going to show you this structure. So here is another view of this cross section that we already mentioned it. This is the view from the left side and from the above and from the anterior side to the penis. So the layer, first the outer layer is the skin and the subcutaneous connective tissue with the pigmented and some hair which is called pubes. Under that is the superficial fascia of the penis. Then we have the superficial vein of the dorsum of the penis. Then we have the deep fascia of the penis. Then we reach to the deep vein of the dorsum of the penis, then the artery of the dorsum of the penis and the nerves of the dorsum of the penis. Then you will reach to the surface of the cavernous body, which is on the surface is covered by the tunica albuginea. Here in the middle is the septum of the penis or pectiniform septum. Inside the cavernous body, we said that it's the endothelial space, the caverns, the space that is filled by the branch of this artery, which is called deep artery of the penis, which gives the helicina artery, and it's important in the erection that I'm going to discuss. And finally, here is the spongy part unpaired, that inside it passed the spongy part of the urethra, and in both sides you can see the urethral artery. So this is the same view or the same layer that you can find it in the penis. It's interesting to know that in each ejaculation it contains about 2 till 6 milliliter of the semen or ejaculatory fluid. This fluid has the pH approximately 7 till 8. Normally it contains 150 till 600 millions sperm, and this process of the erection and emission. And emission is made by the parasympathetic innervation. It means under the influence of the autonomic nervous system, the parasympathetic part that is making the widening of the arteria helicina, and in this case the Ebner's path that they are allowing that the entrance of the blood suddenly to this endothelial space of the cavernous or the caverns go and increasing the size of the penis, and the erection it will be remaining till by this enlargement of the size of the penis, it's pressing under the veins of the penis, which is called cavernous veins. So in this case, the drainage of the blood to the veins, it will come slow down, and erection it will be staying good for some period of the time. And during to the emission, the sperm and the secretion, ejaculatory secretion, it's reaching to the ampular part of the urethra. It means at the beginning of the spongy part of the urethra, and this is also under the influence of the parasympathetic, and it's ready for the ejaculation. And I already mentioned that the ejaculation it will be facilitated and easy by the secretion of the bulbourethral gland, which is the sticky secret it has that is lubricating the surface of the urethra. And ejaculation it's influenced by the sympathetic part of the autonomic nervous system, and this is the two difference of the innervation for the erection and emission is by parasympathetic, and ejaculation is by sympathetic influence of the autonomic nervous system. So regarding the external male genital organ, this is the penis. And as we said that the penis is approximately, the length is variable. Of course, it's the normal average is 15 centimeter. Here the penis is starting as a root of the, or radix of the penis, which is attaching to the crista phallica, to the ramus of the pubic bone. These two, this side and this side, are the crura of the penis, which is formed by the cavernous body or corpora cavernosa. And here, this part, which is the unpaired structure, it's the corpus spongiosum, or the spongy body, and is starting as a bulb of the penis, and it continue as a spongy part, which the urethra is passing through here. These two corpora cavernosa, or the crus in the middle, they are separated by the septum of the penis. This is the dorsum of the penis, the body of the penis, which is the dorsum of the penis, and this is the urethral surface, because the urethra is passing here. And then continue the penis at this part, which is the neck of the penis, the border between the glans penis and the corpus, and finally this part of the glans penis is the corona of the glans penis, and to this area is attached the preputium, or foreskin, that we mentioned is the duplication of the skin here. Then, of course, in this area, it's the place of the suspensory ligament and fundiform ligament that the penis is located. The crura of the penis is covered by the muscle ischiocavernosus, and the spongy part of the penis, or a spongy body, is covered by the superficially by the bulbospongiosus muscle. So this is the external view of the penis. This is the transverse section through the penis that you have seen it in the theoretical part. So here you can see the corpora cavernosa, the two corpus cavernous body, that here in the middle is separated not completely by the septum of the penis, or pectiniform septum. And then here is the spongy body, or corpus spongiosum, that through this corpus spongiosum it passes this structure, which is called male urethra. The spongy part of the male urethra is passing. This whitish structure that you can see around the corpora cavernosa, this is the tunica albuginea here. And then after that, there are the from deep to the superficially is the deep fascia of the penis, and superficial fascia of the penis, and finally the skin. And I don't know if you see or not, here you can see some small structures that we mentioned is the superficial vein of the dorsum of the penis, and here the deep vein of the dorsum of the penis, arteria of the vein of the penis, and the nerve of the dorsum of the penis. In this area there are the deep artery of the penis, and in this area it's the urethral artery, blah blah blah, of the urethra. So here is the spongy body, and here you can see the spaces, the endothelial spaces, which is the caverns, and there are the spaces that there are during the erection. It's filled by the blood from the Lysinea artery, which is the branch of the deep artery of the penis, and by pressure to the lymphatic, the venous drainage. So the erection, it will be remaining, and that slowly the blood is empty from these cavernous spaces, and due to the regulation of this Ebner's pad, that it's the smooth muscle under the endothelial caverns, and they are regulating the opening and closing of the entrance of the blood inside the cavernous body spaces, and exit of these spaces. In this preparation, I'm trying to show you the passage of the male urethra. Here, as you see, is the urinary bladder, is the enlarged one of the urinary bladder. Under that and toward the posterior to that is the prostate here. Here is the part of the urogenital diaphragm, and here is the spongy part of the penis. So if I say about the pathway of the male urethra, is starting from the apex of the vesical triangle or vesical trigone, which is starting as a internal urethral orifice, then it is passing through the wall of the urinary bladder as an intramural part, and it enter to the prostatic part as a widening part of the urethra. Then it enter to the membranous part through the urogenital diaphragm, and then it continue to the spongy part of the penis, and between this urogenital and spongy part, which is the beginning, is called ampulla. The widen here in this area is located the bulbourethral gland, which is secretion is lubricating the surface of the urethra. Then here you can see the spongy part of the urethra that approximately 2 centimeters from the external urethral orifice, approximately in this area, you can see the widening part of the urethra, which is called navicular fossa or navicular fossa, and it has a blind recess in superior part, the recess of the navicular fossa. So this is the passage, and finally is the vertically directed fissure or ostium of the external urethral orifice, and vice versa, and this is the paired spongy part of the penis. And here you can see a cross section through the cavernous body or corpora cavernosa, and here there are the spaces of the cavernous spaces inside the cavernous body, and we have similar to that, it's in the other side. So here is the dorsum of the penis, and here is the urethral surface, and here it's the subpubical curvature that I already mentioned. It goes anteriorly and cranially, and here is the peripubic curvature that it goes downward on anterior side, that in the erection, this peripubic curvature it's missing during the erection. So once more, so urinary bladder, internal urethral orifice, intramural part, prostatic part, membranous part, ampulla, the widening the part of the spongy part, the most of the spongy part, navicular fossa, and finally external urethral orifice. Altogether, in average, approximately is 20 till 22 centimeter. From that, 15 centimeter average, it's the spongy part of the pathway of the urethra. So this is very nice cross-section, the frontal cross-section through the lesser pelvis and through the urinary bladder and prostate. In this picture, you have to recognize those structures that we already studied in the frontal section, that it passed through the pelvis. As you see here, you can see the urinary bladder, that here it's the fundus of the urinary bladder, and this part that the urethra is starting is the neck of the urinary bladder, which is directed to the base of the prostate, and the base of the prostate that it's attached to the fundus of the urinary bladder, and the apex of the prostate is toward inferiorly and downward toward the urogenital diaphragm, which is contained of the transverse perineal muscles, the superficial and deep, and the external urethral orifice. We have also the internal external urethral muscle, and we have also the internal urethral muscle also, which is continuation of the sphincter of the vesical sphincter, which is continue to the urethra, and it's preventing the content of the sperm and ejaculatory fluid and urine back to the urinary bladder. So this is the external one. That was the internal one, that is a smooth muscle, but the external sphincter of the urethra, it's made by the skeletal muscle. So in this case, here is the prostatic part of the urethra, and this is widening part, which is called the colliculus seminalis, that you can see in the center utricles and in two sides the opening of the urinary bladder, and here is the prostatic sinuses, that they are the place for the opening of the prostatic duct from the glands of the prostate. It's open to the prostatic sinuses. So here then the urethra is passing through the urogenital diaphragm, as we mentioned it, through the membranous part, and it enters to the spongy part. It means that here is the bulb of the penis and the spongy part of the penis, which is covered by the muscle which is called bulbospongiosus muscle, and in the both sides you have the cross of the penis, or the cavernous part of the penis, which is covered by the muscle which is called ischiocavernosus muscle. So in this case here it will be a obturator membrane. So in the external part we have the obturator externus muscle, and here is the obturator internus muscle, and here it's the levator ani muscle which is making the pelvic diaphragm, and it's related laterally with the prostate is related with the levator ani, or the pelvic diaphragm. In the fascia of the obturator internus muscle, so you have the pudendal canal, and the pudendal canal, it contains the internal pudendal artery and vein and pudendal nerve, and also this area is the ischioanal or ischiorectal fossa, which is mainly contained of the fatty tissue, and in this area we said that is pudendal canal. So here is the proper prostatic capsule, and here is the periprostatic capsule, and here is the venous plexus of the prostate. And in this case there are the passage of the obturator nerves and the vessels, and here is the ductus deferens in the cross section. You can see that from the posterior side of the urinary bladder it passed, and it's located, the ampulla of the ductus deferens is located medially to the seminal glands, or the vesicula seminalis. Dear students, that's all about the male genital organ. I hope you like this video. I would like to thank my colleague Dr. Petrashek for his help, and study hard and stay safe. Thank you for your attention.